Hi, good morning. Good morning, everyone. Today. It is a small video related to. I want to discuss a pathophysiology of fever and SOB. Okay, pathophysiology of fever and SOB. Uh, in cold condition during COVID-19, the main symptoms like fever and SOB we have been seeing. So I just want to discuss about the. It's a small video, but it will be useful to you. Okay. In COVID, the source of transferring transmission was through respiratory pathway. How it was transferred from one person to another person through the respiratory pathway, like through the cough, through the respiratory droplets. Okay. So everyone knows cold have has disturbed many lives. Many people have been lost their life in the when this disease attacked. Okay. So today I just want to tell how the pathophysiology interlink the symptoms and in the COVID conditions why we will see the symptom called SOB, shortness of breath or hypoxia or temperature increase. Okay, fever. Why fever is appeared in the COVID-19. Okay, let's discuss about that. So this is the virus particle. Okay. It transferred to it was entered into the human body through the through the source through the root like cough and sneeze through the respiratory droplets. Okay. After that, it is a normal lung. Okay. So this virus entered into lungs. In lungs, it entered into alveoli region. Okay. So this virus enters into the alveoli and attacks on type 2 pneumoreceptors. Okay. What are type 2 pneumoreceptors? Generally, there will be two types of pneumoreceptors. They are type 1 pneumoreceptors and type 2 pneumoreceptors. Type 1 pneumoreceptors are useful for exchange of gases and CO2. Type 2 pneumoreceptors are useful in the maintenance of lung surface tension. So, uh, the lung should be maintained in a proper manner. It should not be collapsed. Should not be degraded. So this type 2 pneumoreceptors maintain the lung surface tension. Okay. When these virus particles are entered into the lungs through in the alveoli, through the cough and respiratory droplets, they will attack on type 2 pneumoreceptors that which are present in the lungs, that which are present in the alveoli. Okay. So this type 2 pneumoreceptors also called as in alveoli ACE2, angiotensin converting enzyme 2. Okay. So this virus enters into the alveoli region, it attacks on type 2 pneumoreceptors and they release two types of enzymes. First enzyme is single stranded RNA. Okay, this single stranded RNA makes through the it releases single stranded RNA and From this, many polyproteins are formed, okay, through translation process. Okay, the single stranded RNA will enter into the ribosomes, and from the ribosomes, many proteins are formed. So here the process involved is called translation process. Again, this enzyme, the single stranded single stranded RNA. Okay, again this single stranded RNA releases RNA dependent RNA polymerase enzyme that which makes single stranded RNA from the RNA. Okay, so making of synthesis of RNA through the RNA. Okay, this type 2 receptors are called ACE2. Okay, this virus release two types of enzyme. This is single stranded RNA, and another one is RNA dependent RNA polymerase enzymes. Okay, so this all this all polyproteins plus enzymes, okay, plus single stranded RNA. Okay, these are all bunched together. They will attack on type 2 pneumoreceptor that which are present in the alveoli. Okay, so what happens? Let's see. So this all spike proteins, single stranded RNA, and plus all viral, all polyproteins. Okay, this attack on type 2 pneumoreceptors that which are present on alveoli, that which are present in the alveoli. So what happens after they release? Say this is the lung. This is a spike protein or virus particle. Is enter into the lung and they release some inflammation mediators or some chemoreceptors or inflammation mediators. They are number one, interleukin 1, interleukin 6, and tumor necrosis factor alpha. So, when this virus enter into the lungs, they releases some chemoreceptors or inflammation mediators or macrophages. They are called interleukin 1, interleukin 6, tumor necrosis factor alpha. So, these three will leak into the endothelium cells. After they enter, they finally leakage. These are the interleukin 1, 2, 1, 6, and 7. These are leaking into the blood. So, this all three go into the blood, transfer to the blood. So through the blood, after they will enter into the endothelial cells. So in the endothelial cells, there will be the leakage. Okay, so it leads to vasodilation. Okay, and it leads to finally capillary permeability. Okay, so there is a leakage in the alveolar region to the endothelial cells. So the fluid leakage leads to alveoli damage. The leakage process leads to. So there will be increase in the surface tension. Surface tension is increased. Finally, alveolar edema. Okay. So finally, alveolar collapse will be happened. Okay, which leads to hypoxia or shortness of breath, that will SOB or dyspnea. So in the COVID, you will see the first symptom is SOB. So due to the presence of interleukin 1 and 7, interleukin 1 and 6 and tumor necrosis factor only, you have been seeing the symptom called SOP. Through the pathophysiology, the symptom will be appeared, but we will read after symptoms, definition, symptoms, etiology, and we go to the pathophysiology. But this is a process. Through the pathophysiology only, we will identify the symptom. Okay. So here, if you increase the pressure 2 times, tension by radius. Okay. If you increase the pressure, tension will be increased. So there is a pressure in the alveoli, right? So finally leads to surface tension increase. But finally, it makes chance of alveolar damage. Okay. This is the first symptom you will see in the COVID-19. It is SOB. Next, some reactive oxygen species and some proteases. Okay, this will damage both type 1 and type 2 pneumoreceptors. So type 1 pneumoreceptors are helpful in the exchange of gases, type 2 are maintain surface lung tension. So if they are get damaged, there is a improper exchange of gases. So there will no a proper exchange of gases. And this is the lung. Okay, some here, some particles will be there. There are collection of fluid. Number 2, protein deposition. Number 3, macrophages. Number 4, neutrophils. So these all 4 collection, these are present here, deposition. And the patient may get one symptom called cough, productive cough. Okay, and it is a dry cough. So in COVID, you will see the second symptom called number 2, cough. So due to the presence of all these reactive oxygen species, proteases, and collection fluid, protein deposition, macrophages, neutrophils, you will see the symptom called cough, productive cough. Okay. So the third symptom like interleukin 1, interleukin 6, and tumor necrosis factor, they will trigger the central nervous system. Okay. In the central nervous system, hypothalamus, due to the presence of more these two, interleukin 1 and interleukin 6, they trigger the central nervous system, and finally hypothalamus, they trigger hypothalamus and release of prostaglandin 2. And thermostat, hypothalamus maintain the thermostat of the body because our body temperature is completely depends upon hypothalamus. So when these levels, when these chemoreceptors triggers, when these inflammatory mediators are getting increased, they automatically trigger on central nervous system, and it will trigger on hypothalamus, release of prostaglandin 2, and finally increased body temperature. So you will see the symptom called fever. Okay. So low level of partial SpO2, what happens in the COVID patient, or if you are climbing amount, what happens if you're getting the low oxygen levels in our body? So this low partial SpO2 trigger the some chemoreceptors that which trigger the sympathetic nervous system. Okay, and it gets stimulated. So automatically you will see some symptom like heart rate increased, so tachycardia, and there will be a increased demand of respiratory rate. Okay, the heart rate may be about 100 bpm. Okay, so you have been seeing the symptoms called SOB, second to dry cough, number three fever, number four tachycardia. So through the pathophysiology only we will get the symptoms. Okay, and I want to discuss a few points regarding acetaminophen. So for fever, everyone give paracetamol or Dolo or PCM. So this paracetamol or Dolo 650 or PCM, this consists, it is it is a what type of classification? It is an analgesic. It will cure the pain. Okay. It is antipyretic. It will decrease the body temperature. Okay. So for treatment, paracetamol or PCM, neomol or this will come under analgesic and antipyretics. So antipyretics, it will decrease fever in our body. Analgesics, it will decrease pain, okay, mild pain in our body. So what happens? The mechanism. So paracetamol composition, or it will come under acetaminophen. Acetaminophen. So what is the mechanism of action? Mechanism of action of acetaminophen means it will inhibit prostaglandin in central nervous system, because prostaglandins are released when the infection, when there is another uh, interleukin 1 6 and TNF. So mechanism of action, it will inhibit the prostaglandin in the central nervous system. Okay. So I want to discuss some side effects related to. So it will inhibit the prostaglandin central nervous system, and it will decrease the body temperature, and it will decrease the pain. Okay. So I just want to give the contraindications. Okay. It should not be taken with the alcohol. Okay. It has some allergy, hypersensitive action, because all drugs are not suitable for everyone. Okay. It with should not be given with renal disease. Means if the creatinine is above 2.0 mg. Okay, it should not be given to the liver disease if the AST and ALT levels are above. Okay, these are the liver markers that which represent the liver is in the okay good condition or bad. So this drug should not be given if this AST and ALT values are more than above. Okay, and it should not be given with warfarin. Okay, so if you give with the warfarin, it may leads to bleeding. Okay, next side effects. Number one, headache, sweating, vomitings, nausea, rashes. Okay, urine may get dark in color. Okay, headache, sweatings, nausea, vomiting, rashes. Okay, so for every rise of temperature 2 degrees Fahrenheit, there will be increase in heart rate. Okay, so fever is presenting, you will see the same heart rate also increased. Okay, so we have to see everything like so. The question is, what is the uh, antidote for paracetamol poisoning? So you have to answer in the comment section box. Okay, what is the antidote for paracetamol poisoning? Okay. Next, I just want to ask a few questions related. If you have time, you have to uh, discuss in the comment box. Okay. Acetaminophen. Okay. It's an anti-inflammatory. They are used to relieve pains, relieve joint pains. Okay. So here the question is a drug, a drug which has antipyretic, anti-inflammatory, and antiplatelet activity. So a drug that which has antipyretic, anti-inflammatory, and antiplatelet activity. The choices are number one, acetaminophen. Number two, uh, sulfonamide. Okay. Number three, clobetab. Number four, none of this. Okay, you have to answer. You have to give in the comment section box. Okay. So thank you for watching my video. Thank you for watching my video. If any doubts, you have to ask in the comment section box. Thank you. Thank you, everyone.